fresh questions are being raised about what American scientists and federal health officials knew about how and where the coronavirus originated and whether they tried to suppress conflicting evidence. It's not a mere abstract second guessing. Understanding the origins was key then and remains so to deal with a virus that has proven stubbornly persistent. Tonight, what we've learned on the evolving U.S. government response. January 2020, the world first learns that patients in Wuhan, China are suffering serious complications from an unknown virus. And we soon realize infections from a novel coronavirus are fueling a fast-spreading global pandemic. By mid-month, the first U.S. case of COVID is reported in Washington state. Health experts conclude the outbreak is due to human-to-human transmission. Federal officials scrambling to contain its spread offer mixed messaging.
We are urging China. More cooperation and transparency are the most important steps you can take toward a more effective response.
It's really a big difference with the Chinese this time now. They look like they're being quite transparent and cooperative with us.
But how did such a deadly virus emerge so swiftly, so suddenly from a central Chinese province? New internal communications from the National Institutes of Health obtained by Fox News show in the earliest days of the crisis, Dr. Anthony Fauci, the head of the agency's Infectious Diseases Institute, is warned COVID may have leaked from a Chinese government-run lab, the Wuhan Institute of Virology. January 27th, Fauci is told the National Institute of Allergy and Infectious Diseases has been indirectly funding the Wuhan lab through EcoHealth Alliance, a U.S.-based scientific nonprofit that had been working with novel coronaviruses. January 31st, Dr. Christian Anderson, a noted virologist at the Scripps lab, privately tells Fauci that after discussions with his colleagues, some of COVID-19's features potentially look engineered and, quote, the genome is inconsistent with expectations from evolutionary theory, meaning the virus may have been genetically manipulated. Fauci reacts immediately and organizes an all-hands-on-deck conference call with colleagues. He tells the deputy director of the agency, Dr. Hugh Auchincloss, of the urgency. Quote, it's essential that we speak this AM. Keep your cell phone on. Read this paper as well as the email that I will forward to you now. You will have tasks today that must be done. Later that day, Auchincloss confirms a study into experiments with the novel coronavirus funded through the NIAID may not have gone through proper biosafety review and oversight. He tells Fauci their staff will, quote, try to determine if we have any distant ties to this work abroad. Hours later, Fauci convenes a conference call with a dozen worldwide virologists. Notes of that hastily arranged meeting obtained by Fox News reveal suspicions of a Wuhan lab leak are suppressed over concerns that public revelations of Chinese involvement would do, quote, great potential harm to science and international harmony. Quote, further debate about such accusations would unnecessarily distract top researchers from their active duties and do unnecessary harm to science in general and science in China in particular. But some immunologists are not convinced. Dr. Mike Farjan is quoted as saying, I think it becomes a question of how do you put all this together, whether you believe in this series of coincidences, what you know of the lab in Wuhan, how much could be in nature, accidental release or natural event. I'm 70-30 or 60-40. Another scientist at the meeting, Dr. Robert Gary of Tulane University, is more adamant. Quote, I really can't think of a plausible natural scenario where you get from the bat virus or one very similar to it to nCoV, where you insert exactly 4 amino acids, 12 nucleotide, that all have to be added at the exact same time to gain this function. That, and you don't change any other amino acid in S2. I just can't figure out how this gets accomplished in nature. Of course, in the lab, it would be easy to generate the perfect 12-base insert that you wanted. Fauci and others point to evidence the virus may have originated in a seafood and wild animal market in Wuhan. But any scientific consensus is complicated by the market being shut down and scrubbed clean by Chinese authorities. With crucial evidence destroyed or hidden from international scrutiny, outside access to the lab is also restricted. Dr. Gary later says a consensus is reached among the experts on that call. Quote, 1, don't try to write a paper at all. It's unnecessary. Or 2, if you do write it, don't mention a lab origin, as that will just add fuel to the conspiracists. On that call, Fauci and his boss, NIH Director Collins, are again told about separate State Department warnings about lax safety protocols inside the Wuhan lab. It's unclear whether those warnings were expressed to White House officials. Nevertheless, despite the conflicting evidence presented by the virologists at that meeting, Collins seems convinced. Quote, I'm coming around to the view that a natural origin is more likely, but I share your view that a swift convening of experts in a confidence-inspiring framework, WHO seems really the only option, is needed, or the voices of conspiracy will quickly dominate. Just 4 days later, 5 American, British, and Australian researchers, who were all on that Fauci conference call, authored preliminary findings that abandoned their earlier private beliefs that COVID was likely the result of a laboratory leak. It's unclear what new evidence prompted such a drastic 180, but private communications show the various drafts of their report are sent to Fauci and Collins for editing and approval. The records do not reveal if they in fact edited the new version. February 16th, the first public draft is published online. Weeks later, a final version of that report is posted. Again, a total reversal of what those virologists wrote in private emails earlier. March 17th in Nature Medicine. Our analysis clearly shows that COVID is not a laboratory construct or a purposefully manipulated virus. But that was not enough to tamp down what multiple sources inside and outside government believed, that the Wuhan lab was indeed the COVID ground zero. Multiple sources say this may be the costliest government cover-up of all time by China. There is a growing belief that the COVID-19 virus originated in the Wuhan lab, not as a bioweapon, but as China's effort to find and deal with viruses to show the world China was as good as or better than the U.S. on that front. Later that day, President Trump is asked about our reporting.
More and more we're hearing the story. We are doing a very thorough examination of this horrible situation that happened.
The next day, April 16th, a frustrated Collins emails Fauci, wondering if there's something NIH can do to help put down this very destructive conspiracy. Collins' email includes a link to our special report and FoxNews.com reporting. A day later, Fauci replies, quote, I would not do anything about this right now. It is a shiny object that will go away in times. But hours after that, from the White House press briefing room, Dr. Fauci publicly endorses the animal market theory.
The mutations that it took to get to the point where it is now is totally consistent with a jump of a species from an animal to a human.
More than a month later, we now learn Drs. Christian Anderson and Robert Gary, 2 of the authors of that scientific report who were in close contact with Dr. Fauci, are awarded a nearly $9 million research grant from Fauci's agency. A month after that, Dr. Peter Daszak of EcoHealth Alliance, the group that did the original U.S.-funded experiments with the Chinese at the Wuhan Institute of Virology, received a $7.5 million grant over 5 years from Dr. Fauci. President Biden, a year later, tasks the U.S. intelligence community to probe the COVID origins, but its August report was inconclusive, due in large part to China's unwillingness to assist with the investigation. As the lab leak theory gains more scientific traction around the world, Dr. Collins publicly says he's at least open to that possibility. You thought it was not a weaponized thing from the Chinese, but that it may have been a lab accident. It seems more and more pointing that way. Are you confident saying that?
I don't think I have any more new information to be able to tip the balance. Certainly possible that this was somehow understudy in the lab, even though it was not human engineered from scratch. I'm quite confident of that.
But months later, in his last interview before leaving NIH last month, Collins tells Fox News he stands by the natural origins theory.
Frankly, we still don't know. There is no evidence really to say. Most of the scientific community, myself included, think that is a possibility, but far more likely this was a natural way in which a virus left a bat, maybe traveled through some other species and got to humans, and there was no lab leak involved. We won't know unless China decides to open up about this, which they have not done, and shame on them for that.
Fauci says Chinese cooperation should be the goal.
Obviously, you want openness and cooperation. One of the ways you can get it is don't be accusatory. The accusatory part about it is only going to get them to pull back even more.
And that is what has so frustrated scientists and health professionals inside and out of government, as they have tried to cope with an exploding lethal pandemic for more than 2 years with incomplete or inaccurate facts.
Whether it was engineered or not, if we would have known early and there wasn't a cover-up, we could have saved lives.
Dr. Robert Gary, who was on that February 2020 conference call with Dr. Fauci, tells the Intercept news organization he changed his mind on the COVID origins based on new information he and his colleagues received, and that, quote, no one was trying to mislead the public. We should note China continues to deny its Wuhan lab was the COVID source, but last July refused cooperation with a second stage of an international probe into the pandemic's origins. U.S. lawmakers want more answers, too, with ranking members of the House Oversight and Judiciary Committees, Republicans, in recent days asking President Biden's HHS secretary for greater access to Dr. Fauci and NIH emails and notes from the earliest days of the pandemic. And they want to interview Fauci himself. They say the current administration continues to hide the truth. We provided our story to Dr. Fauci's people and NIH, and as of airing tonight, we have not heard a response.